any closing remarks, guys, on basically, overall summary of, key takeaways from, today's discussion, either stuff that you think that, audience should know or that you think is pertinent for, a patient of yours, kind of maybe 1 point per person would be nice to kind of hear out. You want to start?
I would say, I think looking at getting the testing on the tumor risk stratifying the individual patient, all the great points we talked about. Is it low volume? Is it high volume? What is the imaging modality they used? What's the sensitivity, specificity? Is that going to have a high risk of some kind of false positive? How do you interpret that? Think about where you're referring your patient. This may be somebody, if you send a radonc and they have a solitary bone met, probably going to get that bone met radiated. You know what I mean?
Mm-hmm.
Think about being the best advocates for our patients, providing all those resources. When you can't have a nurse navigator, we have that resource, and it's just such a nice thing
right.
to help patients learn how to navigate a very complex system.
Yes.
And we and you guys, we both, all 5 of us, are very, very fortunate to have the support there to get access to these medications that can have some potential financial toxicity, but actually we can, through the support that we have in our medical systems, we can help patients get through that and not be burdened by that, and actually tap into those resources, which is really nice.
Absolutely.
Yeah, no, I think it was a good panel. Thanks for doing a great job running it, and the discussion was great. I think one final point would be is empower the patient, because really in this age of medicine, in this age of information, where patients really have access to a lot of information, right, mm-hmm. in ways that are good and in ways that could be kind of not so great for them.
Absolutely.
And so creating a situation where the patient has good information, accurate information, and kind of respecting that of the patient, it allows a lot of trust to be built, and then that will probably have the greatest impact, honestly, on their outcome than all of the other stuff, right? If they trust you and they have the information and they can access it in a good way, they're going to do well.
Yeah. I guess one thing that I would be kind of looking at is how our PET scans and our imaging kind of guidelines are driving therapy, but not necessarily driving increased survival.
Yeah.
So
Yeah,
I think we've got a lot of trials that have used the surrogate endpoint of imaging to drive like change in therapy, or say that's why. And so we go, oh well, that trial, it said do a scan every 3 months, so we have to do a scan every 3 months, or otherwise, how do we know if there's a fracture? How do we know if there? But it wasn't symptomatic, and it wasn't actually a real change in the patient's condition. And that's one thing I wonder. I mean, are we going to create financial toxicity? Are we going to create, just toxicity from the actual drugs and changing things and going, oh my gosh, now I got to accelerate you to docetaxel now because there's a change of a lymph node on your scan.
Exactly.
That's one concern I have with that.
Yeah.
More of a global comment. I really feel like we're in a renaissance period for prostate cancer, and that's not a profound statement, but I mean, think about even in our careers, like now MRI before biopsy and PSMA PET. I haven't ordered a bone scan since Axemin became available.
Right.
I think a lot of these therapies, and again, this is not a revelation either, but lutetium I would look to move up ahead of taxane. There's all the, like Gautam said, there's all these immunomodulators now, and there's CAR-T and BiTEs, and I don't even know what they stand for, but
Yeah.
I mean, there's a lot of immune modulation coming, and I really feel like we're starting to catch up to breast cancer for personalized medicine and personalized care.
Mm-hmm.
Yeah.
So it's an exciting time to be in prostate cancer.
Yeah. I'd say from a patient perspective, we have great experts today, and it's clear that there's a lot of info. There's a lot of different ways to manage the exact same problem. And I think that that's why the patient-physician relationship is so important, because you have to be on the same team, you have to be on the same goals, having your multi-specialty support, your colleagues. That's how you're going to navigate this, because everyone's going to have setbacks, complications, disease progression. So really kind of having that, listening to your patient, hearing what their pain points are. Do we load the boat and do everything and pare back as needed? Do we ease ourselves into this and ramp up? And everyone's going to manage that differently. So I'd say from a patient standpoint, get that good fit with a good patient-provider relationship, and you know, that will excel your care as well as any level 1 evidence there is. Yeah,
Thanks,
thanks
Joe.
guys.
Thanks a lot.
Hey,
Thanks.
made it easy on me, guys.